If you're over 60, 70, or 80 years old, never ever do these 5 things on an empty stomach. Why? Because doing them without eating first can quietly damage your health. They can mess with your blood sugar. They can trigger dizziness, weakness, or even fainting. They can increase your risk of heart problems. And they can make your medications less effective or dangerously irritating. And yet, millions of seniors are doing these 5 things every morning without even realizing the damage. So today, I'm going to show you exactly what those 5 mistakes are, and what you should do instead to stay strong, safe, and energized all day long. This isn't just about feeling good. It's about protecting your brain, your heart, and your future. So let's get right into it. Let's start with the first and probably the most dangerous thing seniors should never do on an empty stomach: taking medication. Now, I want you to imagine this. It's early morning. The sun is barely up. You sit by the kitchen table with a glass of water and a row of pill bottles lined up in front of you. Blood pressure pills, a multivitamin, maybe something for arthritis. Without thinking, you take your medication, drink some water, and move on with your day. Sounds like a normal routine, right? But here's the problem. You haven't eaten anything yet. And for many medications, that simple detail can make a massive difference. You see, when you take medicine on an empty stomach, 2 dangerous things can happen. First, the medicine may irritate your stomach lining. This can lead to nausea, acid reflux, or even ulcers over time. Second, the medication might not be absorbed properly, meaning your body doesn't get the full benefit, or worse, reacts badly. For example, NSAIDs like ibuprofen or naproxen, which many older adults take for joint pain, can cause serious stomach damage when taken without food. These drugs are known to erode the stomach lining, and without a protective meal, they go straight to work on your gut, not your pain. And then there are antibiotics. Certain antibiotics, like doxycycline, can cause severe nausea if taken without something in your stomach. I've seen patients stop their antibiotic courses early just because they didn't realize the issue was when not what they were taking. Common vitamins can be problematic. Vitamins A, D, E, and K, these are fat-soluble. That means your body needs a small amount of dietary fat to absorb them. Without food, especially fat, your body just flushes them out, wasting your effort and your money. But here's where it gets more serious. Some medications taken on an empty stomach can cause blood sugar to drop suddenly, especially in people taking insulin or other diabetic medications. Others can lower your blood pressure too quickly, leading to dizziness, lightheadedness, or fainting, especially dangerous if you live alone or get up quickly in the morning. I once had a patient, 74 years old, who fainted in his bathroom because he took his medication on an empty stomach and then stood up too fast. He cracked his head on the sink. Fortunately, he was okay, but it was a wake-up call. So here's what you should do instead. Always check the label on your medications. If it says take with food, take that seriously. It doesn't mean you need a full breakfast buffet. Even a small snack like a banana, a slice of toast, a few almonds, or a spoonful of yogurt is enough to provide a buffer and help absorption. And don't guess, talk to your doctor or pharmacist. Ask them, does this need to be taken with food? Can I take it with a light snack? Or does it need a full meal? Knowing the answer could save you from stomach pain, fatigue, or a dangerous fall. And here's a bonus tip. If you take multiple medications in the morning, space them out. Some interact badly when taken together. Others may cancel each other out. Creating a simple morning routine that includes a small bite to eat before any pills is one of the smartest health moves any senior can make. And yet, most people skip this step every single day. So, if you've been taking medication on an empty stomach, don't feel bad, but now that you know better, it's time to do better. Your stomach, your brain, and your whole body will thank you. Let me ask you this. Have you ever gone out for a brisk morning walk or tried to do some exercises at home without eating anything first? You might think it's harmless. After all, Exercising in the morning is a good thing, right? But here's what most people don't know, especially seniors. Exercising on an empty stomach can actually be dangerous. For younger people, the body can adapt quickly to fasting or running on low fuel. But as we get older, our metabolism changes. Our blood sugar levels drop faster. Our energy reserves don't respond as quickly. And our heart and brain become more sensitive to imbalances. When you exercise without eating even something light, your body has to pull energy from your stored glucose. But for seniors, those glucose reserves are not as stable. That means your blood sugar can suddenly crash. And when that happens, you might feel dizzy, lightheaded, confused, shaky, or even faint. One of my longtime clients, Mrs. Linda, a wonderful 72-year-old woman who's been trying to stay active, told me she started doing 30-minute YouTube workouts every morning. But she skipped breakfast because she thought it would help her lose a little weight. After a few days, she started feeling lightheaded after 10 minutes of exercise. One morning she tripped and fell in her living room. Nothing broke, but she was bruised and scared. What caused it? Hypoglycemia, low blood sugar from exercising on an empty stomach. She wasn't doing anything extreme, just bodyweight movements and light cardio. But because her body had no fuel, her system couldn't keep up. This story isn't rare. I've heard it again and again from older adults who genuinely want to stay healthy but accidentally sabotage themselves by working out without eating. You don't need a heavy meal before exercising, but you do need something. Just enough to raise your blood sugar gently and prepare your muscles and brain for movement. Here's what I recommend. About 15 to 30 minutes before any workout, have a small, balanced snack. It could be half a banana, a few whole-grain crackers with peanut butter, a boiled egg, or even a small Greek yogurt. This gives your body a source of quick energy, prevents fatigue, and reduces your risk of falls or confusion. If you're diabetic or on blood sugar medications, it's even more important to eat first and to monitor how you feel during exercise. But here's where it gets even more interesting. Some seniors feel fine until they don't. They push through workouts thinking, "I'll eat after," only to feel completely drained the rest of the day. That's because their bodies go into an energy deficit, which then affects mood, alertness, and even heart rate for hours afterward. I had one patient, Mr. Don, who came to me complaining of afternoon fatigue. He said, "Doc, I don't get it. I walk every morning, take all my meds, eat a good lunch, but I feel wiped out every day by 2 p.m. We reviewed his morning routine. Turned out, he was doing a 45-minute power walk without eating anything first, then taking his blood pressure meds. His body was being hit from both sides, energy depletion from exercise, and a drop in blood pressure from the meds, all while fasting. The solution? A slice of toast with almond butter before his walk. That's simple. Within a week, the fatigue was gone. His energy came back, and his balance improved. So here's the bottom line. Movement is essential as we age, but we have to move smart. Your muscles need fuel. Your heart needs support. Your brain needs glucose. Exercising on an empty stomach is like driving a car with no gas. You might get a few miles down the road, but eventually, you'll stall and it might not be safe. Give your body what it needs before you move. A small snack, a glass of water, and 5 minutes of breathing can completely change how your workout feels and how your day goes. Let's talk about something almost sacred: coffee. For many people, especially older adults, that first cup in the morning feels like a ritual. The smell, the warmth, the comfort, it wakes you up. It makes you feel alive. But if you're drinking coffee before eating anything, you could be doing more harm than good. Yes, even if you've done it for years. Because drinking coffee on an empty stomach can quietly erode your health over time, and most people don't even realize it. Here's why. First, coffee increases stomach acid. That's not always a problem when you've already eaten food helps buffer that acid. But when there's nothing in your stomach, the acid has nowhere to go. It starts irritating your stomach lining. Over time, this can lead to symptoms like heartburn, acid reflux, bloating, indigestion, and in some cases even gastritis or ulcers. I've met dozens of seniors who complain of morning stomach issues, and the first question I ask is, do you drink coffee before breakfast? Almost every time the answer is yes. One woman I worked with had been taking antacids for years, but the real solution was this simple: stop drinking black coffee before eating. Within a week of switching her routine, her stomach pain disappeared. It wasn't magic. It was just about timing. And here's another hidden issue: coffee on an empty stomach can spike your cortisol, the stress hormone. Cortisol naturally rises in the morning to help you wake up. But adding caffeine before any food can push those levels too high. What does that mean for you? Anxiety, jitters, mood swings, a racing heart. And yes, even increased blood pressure, something seniors especially need to monitor. The irony? Many people drink coffee to feel alert and balanced, but drinking it on an empty stomach can make you feel the exact opposite: edgy, nervous, unfocused. If you're prone to shakiness, anxiety, or irregular heartbeat, this one small change, drinking coffee after a light meal, can make a world of difference. And here's something most people never consider: caffeine affects your insulin response. Some studies suggest that drinking coffee without food may impair glucose control in older adults, increasing blood sugar spikes after meals, which can be dangerous for those with diabetes or prediabetes. So what should you do instead? It's simple. Eat something before or with your coffee. You don't need a full breakfast. Just a piece of toast with a little peanut butter, a boiled egg, a banana, or even a handful of almonds. These give your stomach the buffer it needs, reduce acid buildup, and keep your cortisol in check. And if you're someone who can't eat right away in the morning, try switching to decaf or low-acid coffee and sip it slowly after hydrating with a glass of water. I had one client, 69 years old, who was waking up every day with nausea and bloating. She was convinced it was her medication. But we reviewed her routine: black coffee, empty stomach, every single morning. We adjusted it. She now eats half a slice of toast with avocado before her first sip. Within 3 days, the nausea disappeared. It wasn't the medication. It was the coffee timing. Remember, it's not the coffee itself that's the enemy. It's drinking it without any fuel in your body. Seniors are especially vulnerable to shifts in acid, blood pressure, and hormone levels. Your stomach, your brain, your heart, they all need support when you wake up. That first cup of coffee should be part of a supportive routine, not a shock to your system. So tomorrow morning, before you reach for the mug, ask yourself, have I eaten something, even a little? If not, give your body what it needs. A small snack can protect your stomach, balance your energy, and help you actually enjoy that coffee without the side effects. Let's be honest. A glass of wine with dinner, a little brandy in the evening, or even a light beer during a family barbecue. It's not unusual for older adults to enjoy an occasional drink. And for many, it's part of relaxing, socializing, and living a joyful life. But there's one rule that should never be broken: never drink alcohol on an empty stomach. I don't care if it's just one glass. I don't care if it's light. If your stomach is empty, the effect of alcohol on your body changes, and not for the better. Here's what most people don't realize. As you age, your body's ability to process alcohol slows down. Your liver doesn't metabolize it as quickly. Your total body water decreases, meaning alcohol becomes more concentrated in your bloodstream, and your tolerance drops. That's why even a small amount of alcohol, especially with no food in your system, can hit you harder, faster, and last longer than it used to. I remember a gentleman I worked with, 75 years old, healthy, sharp, independent. He drank half a glass of red wine before dinner every night. One evening, his dinner was delayed. But he kept his ritual, poured the wine, sat down, took a few sips, and then stood up. Within seconds, he was lightheaded. His vision blurred. He collapsed. Thankfully, he didn't hit his head. But he was shaken. The ER report said it clearly: sudden blood pressure drop caused by alcohol absorption on an empty stomach. What happened to him wasn't rare, it's just rarely talked about. When you drink alcohol without food, it gets absorbed much faster into your bloodstream. Without the buffer of food, alcohol bypasses the slower digestion process and hits your system all at once. That causes blood vessels to dilate quickly, dropping blood pressure. It also impairs coordination, balance, and decision-making, even after just one drink. And for seniors, that sudden dip can lead to confusion, dizziness, fatigue, and falls. That's not just uncomfortable, it's dangerous. Especially for those already taking medications that affect the nervous system, blood pressure, or blood sugar, which is common for people over 60. Alcohol also interacts with many common prescriptions: blood thinners, pain relievers, sleeping pills, antidepressants. Combined with an empty stomach, that interaction can become unpredictable and risky. One of my clients, a retired school teacher in her late 60s, told me she had a habit of sipping a little wine while preparing dinner. She didn't think it mattered, but she also took blood pressure medication. For weeks, she had been feeling faint around 6 p.m. We looked at the timing. Wine, no food yet, meds in her system. It all added up. Once she started eating a small snack before that glass, some cheese, a few crackers, or a boiled egg, the dizziness stopped. No magic, just simple science. So if you enjoy alcohol, and again, I'm not here to say you shouldn't, here's the golden rule: eat first. Food slows alcohol absorption. It gives your body a chance to process it more gently. Choose something with protein and fiber like nuts, eggs, whole grains, cheese, or even a little avocado toast. It doesn't need to be a full meal. Just enough to line your stomach and prevent sudden spikes in blood alcohol concentration. Also, hydrate. Alcohol is a diuretic, it dehydrates you. Drink water before, during, and after any alcoholic beverage, and always know how your medications might interact. If you're unsure, ask your doctor or pharmacist, especially if you're taking meds for blood pressure, diabetes, sleep, or mental health. Remember, enjoying a drink is fine, but enjoying it safely means respecting how your body works now, not how it worked when you were 40, because the older we get, the more important it is to think ahead. One small glass on an empty stomach might not seem like much, but for a senior, it can mean the difference between a peaceful evening and an unexpected trip to the hospital. Respect your body. Fuel it before you drink. You'll feel better, you'll stay safer, and you'll enjoy life longer. This last one might surprise you, because it doesn't sound dangerous. But it's a mistake I see seniors make all the time. You wake up, you feel okay, maybe not hungry yet. So you skip breakfast, get dressed, grab your keys, and head out to run a few errands, a trip to the pharmacy, a walk around the supermarket, maybe a quick drive to pay some bills. You tell yourself, "I'll eat when I get back." But somewhere along the way, something doesn't feel right. Your energy drops. You feel shaky, tired, maybe even irritable. You can't think clearly. Your legs feel weak. You forget what you were doing. This isn't just getting older. This is your body telling you it's running on empty, literally. Going out on an empty stomach might not sound like a big deal, but for seniors, it can quickly turn into a problem. Here's why. First, your blood sugar in the morning is already low. If you haven't eaten in 10 or 12 hours, your body is in a fasting state. When you move walking, standing, carrying groceries, your muscles demand energy. But without any fuel, your blood sugar can crash. That leads to hypoglycemia, a state where your brain and body don't have enough glucose to function. Symptoms include fatigue, confusion, irritability, dizziness, blurred vision, and even fainting. It's not just uncomfortable, it's dangerous, especially if you're driving, standing in line, or walking alone. And the risk multiplies if you're on medications for diabetes, high blood pressure, or heart conditions, all of which can amplify those symptoms. I remember a 70-year-old man, a kind and proud grandfather, who told me he blacked out while standing in the checkout line at the grocery store. He hadn't eaten since the night before. He just wanted to get some milk and eggs. He woke up on the floor, surrounded by strangers, his groceries spilled. He was embarrassed, but more than that, he was scared. He asked me, "Why did this happen?" I felt fine before I left the house. I told him the truth. He made a small decision skipping breakfast that had big consequences, and he's not alone. Another issue that often goes unnoticed is decision fatigue. When you're hungry, your brain doesn't process information the same way. That's why people tend to buy more junk food at the store when they're hungry. You're more impulsive, less focused, and less likely to make healthy choices. Ever walked into a store planning to grab 2 things and walked out with 10? Chances are, you were hungry and your brain was trying to compensate. That's not just bad for your wallet, it's bad for your body. Because hunger leads to poor decisions, which lead to poor nutrition, which leads to, you guessed it, more health problems. So how do you fix this? It's simple. Never leave the house without eating something. It doesn't have to be a full meal. Even a quick snack like a boiled egg, a banana with peanut butter, a small yogurt, or a piece of toast can provide just enough fuel to stabilize your blood sugar and keep you alert. If you take medications in the morning, eat before you head out. If you're not hungry, at least sip on a smoothie or eat half a granola bar. And always carry an emergency snack with you. A small pack of nuts, a protein bar, or dried fruit in your bag or car. That way, if errands take longer than expected or you feel weak, you're ready. And remember this, going out might not seem like exercise, but for your body, especially as you age, even walking through a large store or standing in line can be demanding. Fuel your body first. You don't send your car out on a long trip with an empty tank. Don't do it to yourself either. One last story. A woman in her late 60s came to me after a minor car accident. She didn't crash from distraction or poor vision. She fainted while driving. She had skipped breakfast, taken her blood pressure meds, and was running errands on a hot day. Her blood sugar dropped, her pressure dropped, and her brain just shut down for a few seconds. Luckily, she hit a signpost, not a person. It could have been much worse. From that day on, she promised herself, "I'll never leave the house without a snack in my stomach." That promise might have saved her life. So here's yours. Before you go anywhere, eat something. No matter how small, it could be the smartest decision you make all day.